Well, hi, everybody. Welcome to GW Center for Integrative Medicine YouTube channel. I'm the co-host, Dr. Kogan, and have such a pleasure today to have an old friend of mine, Wadud Henry Cretela. Wadud is, we're going to use English names.
Okay.
You'll understand, everybody will understand why I'm using Sufi name in a second, of course. But so Henry has been a friend and a mentor for, I don't know, what do you say, 20 years?
I
Something
think
like
so.
that. That sounds
Yeah.
right. So, and we recently reconnected and we were just chatting, thinking about what do we want to do together. And so we decided to talk about this really interesting topic of power of small groups. But before we jump right in, I want to just tell listeners about Dr. Cretela a little bit so you have a full context. So, Dr. Cretela graduated from Vanderbilt Medical School and completed his psychiatric training at Strong Memorial Hospital at the University of Rochester in Rochester, New York. His professional career spanned over 40 years as a general and child and adolescent psychiatrist and included teaching, administration, clinical practice, and consultation in Greater Rochester and Western New York areas. And this, along with his spiritual and especially mystical interest, led him to certification as a mind body practitioner through the Center for Mind Body Medicine with Dr. James Gordon. Of course, those of you who've been following this podcast already seen our podcast with Dr. Gordon from, I think, more than a year at this point before. Dr. Cretela retired several years ago from active psychiatry practice. We're thankful for that because we can actually get your time. But continues to incorporate what he has learned into his spiritual practices as well as his continuous teaching and leading groups. Dr. Cretela studied and practiced Tibetan Buddhism for several years, along with training in martial arts. I'm sure we're going to talk about that. He then immersed himself in the more universal Sufism of Inayat Khan and Indian music for close to 20 years. He functioned as a senior teacher in an IIT and order and Sufi healing order before pursuing his independent practice and study of mysticism. So, Henry, welcome. It's such a pleasure. As I mentioned, let's jump right in. I mean, you've been my teacher and mentor forever. I know you've mentored, I don't know, dozens, if not hundreds, of younger people and all people of all ages. And, when we reconnected, we talked about, that you really at this point in life love to run these small groups. And I wouldn't say run, I would just facilitate, I guess would be the right
Yeah,
term.
it's a better word.
Yeah.
Yeah.
So, and, when you talked about this, it hit me so hard that I think most people will connect to this very simple principle that we all have a small circle of close friends and small circle of people we like to particularly communicate certain points with, right? So this idea of a small group, now how small that is, I think that's quite flexible. But the idea is simple. I think a lot of truth and depth and sort of a personal growth occurs not necessarily in the large groups or even one-on-one with the teacher, but in this camaraderie of couple of or a small amount of souls who find very close working relationship on that level of spiritual growth. So with that, I'm just going to hand it to you and let's listen to what you have to share with us.
Well, thank you for inviting me, and it's really nice reconnecting. Uh,
Mhm.
I've been thinking about you, and I've been following some of your progress professionally, even though we weren't talking very much for the past couple of years. But I'm really impressed with your dedication, and I love how you're folding what you feel is important into your professional work. That's something that I tried to do when I studied that when I had the certification with Jim Gordon. And I did that to some degree, but when I think back, I wish I had started earlier and had been a little more successful with that. But so I really appreciate this, and I congratulate you for your persistence and your success. And
Thank you.
I want to stay connected with you a little bit better than we have in the past couple of years.
Well, this is why we're doing this.
Yes. So uh, I think I had the fantasy, and I still have the fantasy that more is better.
Hmm.
but apparently that's just not in the cards for me. And now I like the small groups and I like the personal connection. Um, the it's kind of like what has turned into lately with the classes that I run, mostly on Zoom now because of the way things have gone. It's kind of like graduate level courses or I don't know, spirituality 301. Like it's intense and there's a lot of discussion and people share their perspectives and I still get to put in my 10 cents and organize and lead and facilitate and that's been I've really enjoyed that. And when I think back on my career, that's most of what I've done most of my life. And but it is interesting to me that I've always had the fantasy that more was going to be better and why aren't the groups bigger so I'm still working on that and I think that's something that may have been I was going to say cultural. I'm not quite sure I mean culture. I think as a society we're fed this idea that bigger is better. You know, the
Well,
more
and also look historically when Pir was alive, the events were massive, right? I
right,
mean, the
right.
event would have thousands of people at the camps and and then even during the pandemic, when Perzia was teaching some classes, we would have 500 people. But I when we first reconnected and started talking, I had this complete epiphany when you were describing what you're doing, and I'm like, this is the real work. I've tried to teach big groups, and I always walk away from this with the feeling like I have no idea what just happened. Like I don't understand if I give anybody anything. It feels very like talking heads, and frankly, I reflected on the fact that every time we would have a small group, whether it's our Sunday healing service with just 3 to 5 people, or maybe 6 or 7 sometimes, or if it's, when we actually used to have our Baraka Center classes, we would usually have a small group. And the depth and the power and intensity that comes through, you can't compare it. And I agree, more is better because I mean, I think we want to reach more people, right? I mean, our souls are like, okay, well, let's like help other people. But the reality is there is some kind of a threshold because I think in those larger groups, there is no magic. It's just kind of this either the energy is too spread out and people are too concerned about staying protected, or maybe it's just simply it's too diluted and you got all these different energies in a room or in a virtual space and they're really not clicking. I don't know what the answer is. I mean, I hope to hear your ideas on this, but in a small space, that's where I think the magic happens. And by the way, this is also very evidence based, right? Like if you look at all the programs, like whether it's a Jim Gordon program or even like original MBSR, how it was practiced, not like in the last few years, but like every or any shared medical visits. I mean, they're usually the wisdom is you don't go over 12
Yeah.
because once you start getting 15, 20, it's too vague. It's too big. It's not powerful enough. And maybe it's simply because there is some ideal number. I don't know. I don't think it is. I think it's very fluid and very flexible.
Right. So I think so the groups, most of the groups I have, I think the smallest group has 3 people in it. That's really small. That's specifically designed that way. So
Mm-hmm.
that's we're studying one particular psychologist in depth, and it I knew it would be difficult, and actually one of the people in the group was the one who suggested it. So we just chose 3 of us that would kind of plug away and study this. The other groups probably have uh, so the email list would have anywhere from 10 to 12, 15 people on it. The people who actually come
Hmm.
is more like six people.
But there's
Uh,
still that container of, let's say, up to 15 that are
right,
getting all these messages. So even if they're not physically there, you still have them in this
right. And
continuous.
some of them are recorded,
Uh-huh.
and some people actually listen to the recordings. But that's kind of hit or miss. So I think um, so I teach a lot. So I have a lot of classes. So I don't know about when you had the Baraka Center, but when I went independent, so the standard before then, standard is the wrong word. The routine used to be something like one class a week,
Hmm.
and we would rotate who was teaching it. And then we would have a worship service on a Sunday afternoon. And then through the year, you'd have a workshop here or there that it would have could be small or big. And then you'd have visiting people coming in. So when I became independent, I teach every Tuesday, every Wednesday
Hmm.
for anywhere from an hour to, I think the longest one is an hour and a half. Believe it or not, one of the most regular ones is on a Saturday afternoon, and I still don't understand why that's working, but it works, and it'll have 6 to 12 people in it. And then we do regular chanting for a half hour every Sunday night, and we do an, uh, an arts and poetry kind of thing on a Friday, a celebratory semi-worship chanting service one Saturday, and then in between, I'm doing research and I'm guiding people. That's like a half-time job.
That's exactly right. That's what it's
Right.
like. You
And
sort of like you form this very cohesive group with the flow and the schedule and very clear expectations of what's coming when, by the sound of it.
right. So now part of this is me. I'm very regular. So I don't usually cancel a class. That's really unusual. Partly because I love what I do and I'm not traveling much anymore and I'm retired.
Hmm.
So I don't, and I don't have lots of grandkids living around me where I'm babysitting all the time or something like that. So I
Hmm.
can do that, and that's important to me. So what I tell people is what I'd really like you to do is pick the classes or whatever they are, whatever you want to call them, and talk to me about it, especially if I'm your spiritual guide. And here are the ones that are really important. And then put it in your schedule and make a point of coming to those regularly, because that's where I think the secret is. There's a rhythm to it.
Hmm.
And some people do that. Some people sign up for everything, but then it's hit or miss. And what I do, and this is something that I've always been able to do, is I can catch the thread that's developing that holds all of the class, all of the experiences together.
Hmm.
So this is, 90% is I don't know what I call it. I think of it as mysticism, but it's kind of spirituality, humanism, mysticism. We have a book club. The book club is on biographies because I'm a shrink. I love to see how people live their lives. But the discussion is not just about how was the book written, but it's also uh, what do we glean about these people and their lives and their experiences, and how does that affect us, and how does that compare with what we're doing? So there's always that kind of psychological, spiritual look at everything we do has something of that in it.
Hmm.
And some of the classes are very intensely about mysticism, especially in the lineage of Inayat Khan. Um, but I'm at all the classes and I can see what's developing. And there's something developing. And the more somebody is regular and the more of the experiences they go to, the more they can pick up the thread. And that's what I'm finding. And for the people who don't come to a lot, if you work with me, I wind up filling in the gaps because I know how to catch the thread and make it clear in the different classes. I don't think I could do that in a huge group. I think it's the smaller group and the intimacy that gets developed and the rhythm and the routine that really works with that. Um,
You
you
think
know,
you think people come to you because in part because you shrank? Do you think that this group
yeah.
became so cohesive and constant and sort of ongoing and engaged because you're shrink, or do you think that doesn't really matter and that sort of
No, I think people there were some people I think they were attracted to me because I they knew I was a psychiatrist and I had a psychological attitude. That can go both ways, you know. Some
well,
people
it's an
stay away
interesting
from me because I'm a psychiatrist, you know.
well, it's an interesting point. I was
Yeah.
recently talking to Christian minister who's a therapist, and he basically said in his lineage, and it's a large church, they highly advocate for therapists to offer a combination of spiritual guidance with therapy. They believe that it must be combined, that it's ethically inappropriate to separate. They feel strongly that there's that you if you're a therapist you must and minister you must do both. Like if you don't do both you're violating ethical code of conduct in their church, which I find it kind of crazy, funny, ironic, because in our own
Mhm.
order it's there's been a attempt to do the reverse, which is insane because that's not how human psyche operates. So trying to put synthetic barriers on this is
Right.
going
You
to
were
fail.
saying in your professional organization or the
No, no,
spiritual
no. It's
organization?
just it's my my older son's boyfriend's dad, girlfriend's dad. And so he's a therapist and he lives in a spiritual community. It's a Christian church. And we just got to talk, and he was telling me how, they basically on purpose combine the therapy with their
Yeah.
spiritual guidance because that's recommended. So that's their standard in essence. And we were discussing. He also teaches some small groups, and he has
Hmm.
clients. Like so, I've been talking about this also in preparation for today's conversation, and I did a lot of thinking how you can't separate these things. If you're coming to the any group with a certain amount of professional base, you're not going to be able to put that on a shelf in there. It's going to come and it's going to serve other people automatically, and I think maybe, and I'm sure that the reason this group formed, not only because of that, right? I mean, it's just that cohesive energy inside the group, and everybody clicks and they come to the offerings they like the most, but the container is there.
Yeah.
It's
So
real.
I agree there are boundaries and I think I keep some boundaries,
Mhm.
but I would say a lot of the people that I work with stayed with me when I left the leadership of an organized Sufi order.
Mhm.
So I think I would have trouble, and I don't attract a lot of people, uh, partly because they can't find me. So I don't publish. I haven't written a book. I do have some podcasts, but they're not super popular or anything like that. So I don't have enough reach that way. And I have a website, but it isn't getting tons of hits. So I'm not a good marketer. And you know, I thought about I was working with somebody who helped, but I didn't hire a professional that and it's too late in my life for me. I'm ending my I retired already as a psychiatrist. So um that part is disappointing. I don't feel like I have enough reach. So a lot of the people I work with were kind of already working with me and then stay with me when I left the leadership of the organization because of the connection we had. And then I have some other people have joined, but not as much as I wish. Like I think might happen if I were a better marketer or something.
But maybe
So,
that's the blessing. I think that's the blessing. Imagine you would have bigger reach, more
mhm,
professional support and all that, and suddenly you have this podcast and hundreds of followers, and your process will shift, and interestingly, I'm in the same exact dilemma. We have this Friday afternoon, 2 to 3 p.m. mind, body, and COVID class, which we've been doing since the COVID hit. And we sort of settled at around 25 people, like the between 20 to
mm,
30 in that range. And it's a little different. It's not like we teach. So there's not a lot of there's no discussion. There's opportunity for Q&A for at least 10, 15 minutes, but it's not an actual continuous engagement. Like it's
mhm,
not there's no deep sharing during the class, for example. But it did form this cohesive container for this number of people. And I actually beginning to see that some of these things, they're organically merge from the certain depth of each person's need, from their souls of desire, and then and it comes together in this particular formats. And I like to, I mean, we're calling it small group, whatever, it doesn't really matter. It's a certain set of human relationships
mhm,
and certain set of following information and processing it because it works for that particular person. And interestingly, I've tried to engage a lot of people over the past couple of years to join this group, and it's not growing.
yeah.
And I'm sure it's not growing because there is this need for this group to stay this way.
Yeah.
Otherwise, it will change its dynamic, it will change its energy. And I used to stress over that too, like, oh, why are we not growing? And I'm like, oh my God, thank God we're not growing because
Right.
I wouldn't want to start. Like, I really like interaction with these people. I come to this excited. I want to do this. And if it would be any other way, I think I'd feel a burden of some sort. I feel like, okay, now I want to move on.
Well,
Right.
the intimacy is great. The issue is that everybody has a life, and if the group is is small to begin with, and
Mhm.
then two, three people can't make it because of some other commitment, then when you have the interaction, it's even smaller.
Right.
And I really, rarely do I just lecture for an hour or a half an hour. We might be studying a book and I read an excerpt, I put in my 2 cents, and then we have a discussion, and there's a give and take. And if the group gets too small, there's not enough to have the interaction. So, um, there's a there's a critical mass, and
Hmm.
I think I found it. I mean, I think I still would like to have kind of a larger reach. That doesn't mean the classes have to get bigger.
Larger. Right.
It's
Right.
kind of like, well, if these 6 people want to come to this class and there's another class and three of those people come, but there are three different people who come to that class. And yeah, that's kind of, I
So,
think,
so not necessarily the class grows, but the number of offering grows, and and
yes,
and a number
right,
of different groups changes and
right.
merges. Yeah.
But
That
I say
that's
that, and
key.
then, the people who are coming to most of the classes, they're catching the thread. I mean, and I work with them and I still guide people, so I work with them individually as well as just in the classes and the experiences. But I got to admit, when I look back, even over my professional career in psychiatry, I mean, I went to a small high school, I went to a small college. Vanderbilt was not a big medical school. I think back in my day, our class had 56 people in it.
Wow,
Uh,
I'm sure it's way bigger now.
oh yeah, well, they were trying to keep it small, and they were forced to expand to 56 to get federal money. And I always had close personal friends rather than a huge cohort of friends. I'm a 1 to 4 person kind of guy that I have close relationships with. And the psychiatry program I went to was at Rochester, and it was on the smaller side, and child psychiatry was really small. Um, Rochester's not a huge city. It's middle of the road. I can go to a much smaller city, but this is a comfortable size for me. So somehow it's always been that's my niche. And in psychiatry, it's a very intimate profession. You do a lot of therapy. Even if you're doing a lot of medicines and quick evaluations, it's one-on-one. Your caseload tends to be smaller than geriatricians and pediatricians and I don't know how you guys do it. It's you know,
Well, I mean, but it's different, right? So it's not
right,
as, I mean, it's not as soul searching, and the
right. That's the
directions are
right. So
they
so anyways, I think so it isn't just the small group. I want to this is connected, but um when I was practicing psychiatry, it was psychiatry, and because of the ethics in the psychiatric profession, I had to be really careful about introducing some of the spirituality that I knew was important for people and that I was getting interested in. So I clearly didn't want to convert somebody, but I knew this was an important part of their life. But there was this boundary psychiatry tried to put up. And
Mhm,
also they were demeaning spirituality from Freud on.
mhm.
Um, and that started to change. So I used to laugh because the profession is saying you have to be very careful about this. You can't be proselytizing or sharing your stance with people or something like that. And then I would get these questionnaires from the insurance company saying, well, our clients would like to have practitioners who have a Buddhist orientation or a Christian orient. And you have to check off, do you have that orientation? It's like, what are you talking about? You're supposed to keep this separate.
I think honestly, I feel like there's so much misunderstanding and hypocrisy here. If you think
Yes,
about
right,
this, if you think
right.
about this, when our medical organizations still don't like convert people, it's basically coming from the place of total ignorance. It basically coming from the place thinking that somehow a healthcare provider is out there to influence people's decision making on what spirituality they want. Like it's like it's a kindergarten, right? I mean, in reality, when we're working with the suffering with the suffering, all we care about alleviating the suffering and making a person feel better. And if in that domain person says, look, I have a spiritual suffering, it's unethical not to go there. Like
Right.
it's a self-explanatory concept that medicine for decades was thinking about this wrong, like the putting these boundaries and all that. The reality is, of course, there are always boundaries that are needed, but that has nothing to do with just spirituality. The boundaries are needed around any human topic that has any level of sensitivity, whether
Hmm.
sexual health, psychological health, any kind of, it doesn't matter. You have to have certain boundaries. I'm gonna have another podcast with Christina Puhalski, who's a Jewish um, head of Jewish, and I'm sure we're gonna talk about this quite a lot because in her professional career, she spent decades convincing healthcare field that you have to have spiritual care built in, right? And
Right.
it finally got to a point where we now actually have an ICD-10 code for spiritual distress, and that's actually requires like spiritual counseling because that's a
Right.
spiritual distress. You're not going to apply,
But it evolved. I mean, I think one
what
of
is it?
the for me, what really helped was I did uh one 7-day training with John Kabat-Zinn, and mindfulness was everybody wanted to develop a mindfulness program. I didn't train fully with him, but I
Mhm.
had that exposure, and I saw how he was able to bring that into mainstream medicine. That was a real gift.
That was a
And that's what
genius,
attracted me to Jim Gordon's program,
right?
is that, I mean, it was mind body medicine. When I started to introduce it, I called it mind body spirit. And what I found is when I started my spiritual training, in Sufism in particular, but a little bit in Buddhism. Um, I mean, I would laugh. I mean, I've always said this is that I didn't get formal psychiatric training in cognitive behavioral therapy. The little bit I did, for me, it's really boring.
Mm.
I just couldn't get into it. But the Buddhists were doing it. They had been doing it way before the psychiatrists were doing it. And they do it when they do it, it's really interesting.
Mm.
But it was the same thing. So I'd be learning uh, Sufi spiritual practices, and I'd say, oh, but that's kind of the same thing I use with some of my psychiatric patients. I just call it something different. There was this enormous overlap, you know. So in the Sufi training that I had, at the time that I did it, in a particular organization I was part of, there was a real fear about anything psychological. So I don't know if you remember that because I think it's changed over the years.
Yeah, I mean, I think my training was after that. I think when
Yeah,
I was,
it was really striking because you know part of so the founder of the Sufism that came in that I studied with is Inayat Khan from India. And you know the Sufis would say you want to beautify your personality, and I'd be thinking, well, if you want to do that, but you're not allowed to talk about your personality psychologically, what kind of that doesn't make any sense. So
yeah,
you kind of knew it was kind of silly, but there were these boundaries that were set up. And part of it is, I think there was a fear, some of it legitimate, that someone with no with insufficient psychological training, but who was being a spiritual director or spiritual guide wouldn't know what they were doing in certain areas of psychology,
yeah,
mental health.
that I can totally see. But
But
we're
it also worked the other way around. That
right.
in my training as a psychiatrist,
Uh-huh.
I didn't get very good training back in those days about somebody's spiritual distress.
Right.
And uh, so what I like, I've always the other part about me personally, for whatever reason, is I've always been attracted to these gray areas. Um,
Uh-huh.
so when I when I was in medical school, uh, sorry for the pun, but surgery was like too cut and dried. It was like you have to know exactly what to do. In medicine, it was like you're supposed to know what to do. I mean, medicine really is more of an art than what I'm saying. I'm stereotyping it. But psychiatry was like an art form. It's like I could listen to people and I had this menu of choices and you could mix and match and you know, there were still correct things to do and incorrect things, but still there was this gray area. And I get really attracted to those gray areas where the boundaries are kind of, you know, you don't really know. And I like to explore and I like to integrate and see how things fit together. So that's part of what attracted me to psychiatry. So when I became independent of an organization, both I retired from psychiatry and I no longer wanted to be a leader in a particular or spiritual organization where I felt like it was just getting too bureaucratic. It was like wasn't as bad as psychiatry, but it's like it was too narrow. All of a sudden, I could be free to integrate all these things that I think were interesting to explore and helpful. And that's what's exciting to me. So it's like, you know, do I teach Sufism? Yes. But you come to some of my Sufi classes, we're talking about psychology, philosophy, whatever I can say about
So you're
quantum physics, I
contradicting
think I
yourself
know.
very simply. There are no boundaries. In
Well,
reality, we create the boundaries because we're always afraid of a pathology. We're afraid there's going to be a schizophrenic who's not going to be oriented to
yeah,
the reality,
right,
right? We're
right.
afraid that a teacher is going to abuse some power and will have some
Right.
sexual connotation. But the reality is when the true healing happens, when we're there in the therapeutic encounters, all of that takes a second seat. It's always in the background, but it's not important because what's important, if you don't pass through those boundaries, healing never happens. I'm becoming to be convinced that in order for somebody to get well, you have to get through all of these artificial constraints. They're screwing the societal norms up, and more importantly, they're really not letting medicine evolve. That's the problem. They're allowing us to practice, they're allowing us not to get our asses sued, sorry,
Hmm.
language, but that's just not how, like, I don't want to practice like this. I don't want to think that I have to constantly remind myself that there's a possible litigation because I didn't write something or I didn't think of something.
Correct.
And
So
so I'm
that's the free.
saying
So
something,
the
what I'm talking about is actually very controversial, right? I mean, if one of my billers gonna hear me in university, they're gonna freak out because
Mhm.
they're gonna say, wait, but that we can let go of all this because what we're discussing here is actual truth and depth of healing. We're not talking about practicalities.
So the biggest influence I had psychiatrically, it was a slow uptake, but I became a real fan of Carl Rogers and the person-centered approach. And when I was in med school, um, I remember learning about it. I'm just laughing at myself because of how long it took me to catch on. But I had a chance to do some library research. I can't remember why I was doing this on the efficacy of psychotherapy. So you got to remember this is a long time ago. So it was 1975, 76, I think. Um, and at that time, the only psychotherapy that had evidence-based research support for efficacy was the Rogerian approach.
Mhm.
Everything else, you couldn't tell, there was no effectiveness compared to placebo or a waiting list. The one that had was the difference was his approach. So then I got busy with all this other stuff in medicine. And when I did my training in child psychiatry, so many years later, in the 1980s, late 1970s, early 1980s, I had the person who was teaching my introduction to child psychiatry when I was in general psychiatry was a Rogerian from a child orientation, right? And I used to give him such crap. And he would pull me, it was a small class. He'd
Mhm.
show a videotape. The tapes were old. He was an older guy and he had tapes that were from the 1950s. And we would say, these aren't the kids we're seeing right now. And he said, I know, but the point is the technique and all of this stuff. And so I would say something in class and he would be okay. And he pulled me out in the corridor and he says, you're right, but if you keep saying it that way, the other people are going to get the wrong idea. So we would joke back and forth. It took me years to discover the gift that this guy had given me. Yeah, and I got to give myself credit. I wish I gave myself more credit. But before he died, I took him out to lunch and I said, I didn't know what you were giving me, and I want to thank you. It took me years to discover this is really gold. And we laughed and we joked a little bit. So I have folded this into everything I do. The point is Rogers is saying what you said. When he started, he made part of his name in Rochester, New York. I don't know if you knew that.
Mhm.
He was the head of the then Rochester Child Guidance Clinic, and he was the reason insurance companies started to pay psychologists rather than just psychiatrists. So the psychiatrist hated him. And
Another boundary.
the analyst didn't like him because
Yeah.
he was saying this analytic stuff, what's important is three things: empathy, unconditional positive regard, which means warmth, and what he called congruence, which is authenticity. You walk your talk. You're basically an authentic person, right? That's it. And what his research showed is whether you were an analyst or a behaviorist, a school teacher, a parent, a business person, if you had those three elements and you could communicate it, that's really important.
Mhm.
Something happened that was healing in the relationship.
Mhm.
He didn't have as good research in terms of outside of psychotherapeutic encounters, but he was beginning to get that. And he was teaching counselors and aides in schools and things like that. So that is, and also that got, in my view, misused. So remember the EST programs in California, and I know some people still love those. In part of the course I was telling you about when you and I were chit-chatting last time, I call it being a healing presence. I actually have a class in there where I say humanistic therapy run amok. It's taking those principles and going wild, and
Mhm.
people really getting hurt, thinking that authenticity means I can say whatever I want to you about how I feel, irrespective of how you take it. Oh my God, the damage that that was doing, right? So anything can be abused, but if you don't look at the extremes, what Roger said, I had some books where I traced the course. He was very interested in technique in the beginning, almost like a manual, which I hate. I hate manualized therapies, right? At the end, he said, I think it's the relationship. The relationship is what's healing. I still think the best way to get to that relationship is through the technique that I've developed. But he was saying it's not the technique. There's something, if you something happens in the relationship, and it's those qualities that are real in the we got to talk hierarchically first in one person, the therapist, the doctor, whatever you want, the parent. But if it's really there, you're honestly empathic, you're authentic as a person, you don't have this mask on as I'm the doctor and I have to have this persona and a white coat and all of that stuff. And you can communicate that so the person feels it, there's a shift. That's it. And to me, that's spiritual guidance. That's being a teacher. That's being a good friend like me and you. That's that's being a shrink. It's it's my primary care doc. I mean, I look at my primary care doc and he has to put things in the computer, right?
Mhm.
And and he's pretty good. He looks at me most of the time. And periodically I'll say, I want to tell you something.
Mhm.
Stop writing.
Mhm.
And back in the day when he used to take notes, I would say, I don't want you to write this down. He would drop his pen and then we'd have this discussion. And he'd say, well, I have to put something in the chart. How's this? And I'd say, oh, yeah, that's okay. And I know you have to document it. He wasn't lying, but I could have this relationship where I could say, you have to know where I'm coming from. I need your attention. And I know you have to document, but I don't want this word for word. Just let me, you know, it just is pervasive in relationships. If we had relationships that were based on authenticity, empathy, and warmth, and we could communicate it, it's just amazing. So there was that period of time where he was getting some traction. What comes after that? All these manualized, like the research that I know, 'cause I'm not an expert in this, in cognitive behavioral therapy. If you follow the manual, you will have success. As soon as you deviate from the manual, your success rate goes down. I don't want to be treated by a manual. I want the manual to inform. And I try to remember this. So Kathleen had breast cancer, and um, there was an algorithm. For this, this is what you do. And I forced myself to think and say, what if we had a doctor who said, nah, my gut tells me we're going to go do this. I'd be kind of nervous about that, you know? So there's this balance about you pay attention to manuals, you pay attention to what we're calling evidence-based. But at the same time, I'm older than you. I'm old enough to know that 20 years ago, what we thought was evidence-based is
Oh,
crap now. It's not evidence-based anymore. And judgment plays a part in everything. And so you can't throw out the manual. You can't throw out the boundaries completely.
right.
When S did that, they hurt people. Authenticity doesn't mean I can just hurt your feelings because I feel like it,
Yeah.
right?
Yeah,
Uh,
but if we think of boundaries all the time, and if in the name of adab we telling people what they can or cannot do,
right,
like
right.
healing
It,
cannot happen.
I agree. So
It's just
the
that,
small group allows me to not have to pay so much attention to that
right.
because it's a personal connection. People know each other, and over time, so a lot of my classes go on forever. I'm
Mm.
I have a few things like the Healing Presence course I told you about. I designed it to meet once a month for a year. But most of my classes is like, here's the book we're going to study intensively, and we're going to do this till it ends. Now, so we have a class in Sufism on the 99 names, right? So I still can't believe this. We used one primary source, but then two or three supplemental ones. And it took 5 years, 5 years,
Oh,
right?
my
And at
name.
the end of it, I'm taking a breath and saying, wow, I can't believe, and not everybody stuck with it, and people came in and out. And I'm looking at these people on Zoom, right? And I said, so, we're going to be done in a couple of months. And they say, I want to do it again. I said, well, what do you mean you want to do it again? They, well, I missed part of it. Well, okay, but some people were here for the whole thing, and the people who were there for the whole thing said, "Oh no, I want to do it again." It was great, and it was fun. I'm a different person now. I want to go back and know what it feels like the second time around. So we're going back, and um, it's a it's a trip, and part of it is it's small enough that people can share experiences. They they might like study the names in between. My guess is most of them don't. But it's a small enough group that we can talk theoretically, do a practice, have an experience, share it. And part of my job as the facilitator is keep it organized. And then in between, it's like, what's happening? I tried this and something happened. Does anybody want to, let the group know what's going on in their life? That's, so I think I don't worry as much about boundaries in the small group because I don't have to. The only boundary I've had to sometimes I talk a lot in class. Well, you can tell I talk a lot. And sometimes I love discussion, and sometimes the discussion starts so fast that I lose my train of thought. And I am the facilitator. So when I remember, I say things like, I'm going to read a certain section if we're studying a book. And then I want to say what I think about these two paragraphs. And then we're going to open it up instead of just raising your hand every time you have a thought. And everybody said, great. And I told them, I said, because I lose my train of thought and this helps me. The small group said, oh, yeah, we understand that. And they have a chance. And then half the time I forget anyways. And um, so it's that intimacy. You're right. You don't worry as much about the boundaries. Um, I haven't had, I think our ethical statement is treat each other respectfully. Have I ever had a problem? No,
Mhm.
I've just never had a problem. Do I have a faculty I have to? No, I do all of the teaching. I share things with certain people. So I ran a series with two or three people, but I'm always part of it. But I'm trying to empower people to kind of take on a certain project and let me know about it and do it. It hasn't happened yet. Do it on their own. because I really do want to empower people.
Mhm.
Um, that's the other thing that I think it's important to touch on. So, uh, part of what happened is I got really tired, both in the spiritual and the professional realm, of the focus on credentials and where you are in the pecking order. And, are you a clinical professor, a associate professor, an assistant, are you at the U of R, are you at Harvard, or all of that stuff. And then in the spiritual realm, what initiation level do you have? You have to have a certain initiation level to talk a certain way about the teachings. And some of that is like, well, maybe a little of that. Like, I think it's useful that I have an MD and that people knew I did specialty training in child psychiatry. I don't know if I would feel okay about not having that. Like, anybody can go out and practice medicine, whether they went to medical school or not. I think we're beyond that. I think you need something. But the picayuness about, and especially in mysticism, where um, it's a personal, so I don't know if your group, if you talk about mysticism, but to me, the definition of mysticism is a personal connection with something greater than you that gives meaning to your life. The whole point is the personal connection. So there's no intermediary. So yeah, I can be a guide, a mentor, a teacher. I'm supposed to help you get the personal connection, not that I become the
Okay.
ultimate connection, right? And in spirituality, I always irreverently say, there may be like, okay, you have to go through these initiation levels, but if the divine power wants to knock you off your horse like they did to St. Paul, what are you supposed to do? Say you didn't follow the rules? I mean, give me a freaking break. I mean, I actually say that out loud to people because it's true. It's like, yeah, I think for most of us, you go through and you do, you can feel that something is happening. Some people, grace comes in and they get it. Something happens in their life. And
The structure and boundaries are placed by a society, by
right,
organization,
right.
not placed by relationships. Relationships don't have that. Relationship have basically completely different set of rules and processes.
Right.
They're not just more individual and intimate, they get often established on a unique level. I mean,
Yeah,
your small group is going to be different from my small group,
right.
and the rules, internal rules, are going to be different. They're going to be established naturally. They're going to be established based not on, okay, somebody said so, but on the fact that this works for this group. you know
Yeah.
and and, and it's internal to this group. Externalizing it to some other organization is not going to work
So that's, I think you can get to that in a small group. I think it's honestly harder to get that.
in a large group.
I feel bad, people who run the big groups. It's like I do believe you need some quality control. You have to, I can tell what's happening in my little organization because I do almost everything. And I know everybody who's coming to classes. So yeah, I have my finger on the pulse. How do you do that with 600 people or 1,000 people or a faculty of 60 people?
I mean, I
So,
think my sense is that there are some people who like the structure rules, and they like this level of being out there in the public. They like being visible to hundreds and thousands
right,
and millions of people. For some of us, like, I don't really care. Like, for me, I'm doing this with you today because I feel there's a value for some people to listen to this, not because, like, I want to be visible,
mhm,
or some other reason, or some financial gain. I mean, it's like I we doing things because we think that they're authentic and they have value, that their
Right.
value is there is someone, even if one person listening to this connects to this, there is already value in this. And then of course there's always this tension. How do we reach more people? I don't know. I'm actually in lately, I've passed that. Like I suddenly realized I used to think that, yeah, I want to reach more people. And suddenly I realized I'm contracting the reverse.
Mm,
I wanted to learn how to be profoundly effective to a small group of people rather than to just give
right.
some to whoever. It's simply just a period in my life. It may revert back to the
Yeah.
something else, but it feels like I think, and this is why we're talking, like, and this is why I'm doing
Mhm.
this podcast. I feel like the part of this for me is that I'm learning how to go deep, how to
Right.
be with someone and be not just completely authentic, but be in such a space where the space itself becomes the core healing. The space
Right.
facilitates a shift. And I
Right.
know when sometimes I can feel that shift, I can feel that flow. I know this is the right space. And often I'm not. Like often I would be in a particular. Yesterday I had this encounter with a patient. I was sitting there. I'm like, oh, this is not going well. It's like the patient just came with a particular idea of get some narcotics, didn't want to hear to anything, and like it didn't matter what I would say.
Hmm.
But like I was sitting there and I was like, well, what can I do? I'm just gonna sit here. I'm just gonna hold the space and hope for something. And at
Right.
the end, it felt complete waste of time for me and for the patient because the patient just like left after I said, no, I can't write you for narcotics. That's not what I do in this practice. But the reality is there probably is still some level of benefit that she got because I held the container and I just
Right.
said, that's all I can do. Like I can't.
So there's um so I trained with the mind body medicine group.
Mhm.
I did that because I still don't know how it happened. I got some back in the old days. I got something in the mail. He had reach, right? So I go to the first training, it's hundreds of people, right? At a fancy place and all of this. The What really grabbed me was we had part of the training was to be in groups of 10 people. That was the new that's where things started cooking. So you would have big groups and you'd hear something, and then you go to your small
And
groups
okay,
and something would happen, right? So it's kind of like he had reach. He reached me. If he had just been doing small groups of 10 people around
mhm,
Washington, D.C., I never would have found him.
right,
But was the value that I was in groups of hundreds of people? No, what I remember is the 10-person group experience, and I remember when I did the advanced training, I had one-on-one contact with the supervisor, you know. So, it's so for me, it's like I think there's something valuable that's happening in the small groups that I'm running and in the spiritual guidance that I'm doing. But people need to hear about that to be able to access it. So, like I said, in this now it used to be websites, but I look at a website once and I don't look anymore. And Facebook's going, I'm not going to go on TikTok. I'm not a good marketer. You need a marketer to do that. But the secret isn't that you're doing something for 100 people. I think the secret comes when you reach somebody, you plant a seed, and then something more intimate happens at some point, you know? So I want to be able to I want to be able to find something that might be really helpful. I can't do that unless I'm really lucky and I managed to find somebody who's in a small group. Okay, but I surf the web and I read books and I find things. And that's the part that I think I don't want to downplay. We need to be able to get out so people can find us. We had a long time ago when I was part of the local Sufi order, there was a guy who got interested in us, and we were having a little feedback session, the whole group, and we just said, well, especially for the people that are new, anything that you want to tell us that would be helpful. And the person said, you guys are really hard to find. And that's it. That's what it is. So, there's somebody who is communicating with me now. And, one of my first questions is, how did you even find me? So I could do better in terms of marketing and reach. But what I'm finding, and I think where you and I are agreeing, is it's uh, the reach allows for something more intimate to develop. The real excitement comes from those smaller groups where you have a chance to have that experience of working together and learning about each other and having an interpersonal experience that's what's really valuable. So yeah, that's what I'm finding. That's what's exciting to me is what I am able to do is those groups are doing that. And it's been a real privilege I was able to do that.
We have to wrap up, but let me ask you a question. So for
Mhm.
someone listening to this, let's say that they're not in a small group and they are attending kind of different things, they're listening to podcasts and this and that. What would you recommend? Like, would you recommend to almost all the listeners to have some kind of a small intimate group like this, the spiritual group? Or do you think that it's not necessarily universally needed?
Oh, everybody's so different, but I think you have to delve into something. So, I mean, let's say you find like I found somebody online and I went to some of their videos and there were hundreds of people on the video and I listened to the videos for a while. And then he wrote books. I started reading his books. Did I go to, and this was during COVID when I found him, so he wasn't doing seminars. Um, for me, that that was enough. But the intimacy came when with I went and read his books, and I read his books with other people. Kathleen kept on watching his videos, and so she's listening to his podcasts and listening to his videos. That's almost one-on-one, right? He has reach.
Mhm.
But she's not interested in going to a meeting with 100 people. She has kind of, she's doing it one-on-one through media, which you would think would be, well, media is better than I thought it was, than I ever thought it was going to be. You know, like when we have classes, I have people from Florida, Texas, Canada, a little bit in Rochester. It's like that part, that's been really valuable for me. So, yeah, I think uh, you have to play to your strength. How do you learn best? But in general, I think you find something and then you have to let yourself go deeper. You
That's it.
find the
I
way to
think
go
that
deeper.
I think that's the key message. I think if you don't explore a depth of your soul and your spiritual path deep enough, then it's then you need to keep looking for the way of doing this. And,
Right. But
if it's group, then it's yours.
there is one thing that I do think it's important to say with that. So much of what I do has, I would say the biggest depth for me is in psychology, psychiatry, and especially in icon Sufism, but you can get too narrow.
Mhm.
So it depends on what you're doing, what your purpose is in your role. you can go so deep in one thing that you don't see the forest anymore. And for me, having one or two things where I feel like I really dove into this, and then my training, but also my natural personality and my the way that I think, I really do catch threads. And it's what's exciting is, okay, I went deep into psychiatry, I went deep into an icon Sufism. There's always more to learn, but there's such a foundation that all of a sudden, when I'm reading some philosophical book or something about science, I'm saying, wait a minute, I there's a connection in here. And there's a lot of work being done now where people are saying real creativity comes from that. So you need the depth to go, uh, like the basic science that led to the COVID vaccine.
Mhm.
Holy crap. I mean, talk about going deep, not even knowing what usefulness this is going to be, right? And then all of a sudden, these people collaborated and said, well, wait a minute. I have this piece, you have this piece, I have this piece. And somebody said, we can put these pieces together. That's, for me, that's exciting. That's the creativity. So, but a lot of that will also come from, like the COVID vac, a small group of collaborators, right? Not thousands of people. So for me, the balance is get a foundation in something and then get your head out of the, I want to be polite, just look around you and see how's that connecting? What else is happening in the world? And then creativity starts to come. So I appreciate, I think of like my medical school, um, the organization that introduced me to an icon. It's like you're like a big library. Thank you for being there. I'm glad you collected all these teachings. I'm glad I met my teacher. And now I can suddenly see, oh, look at that's connecting with this, that, and the other thing. And that leads to something new and exciting. So
Well, this is Dr. Henry Cretela, my good friend. What dude? This was fascinating. We went way over, but this is great. I didn't want to stop.
that's
Um,
okay. I appreciate the chance.
yeah,
If people want to see what we're doing, amberlightinternational.org. That's the website.
yeah, I'll make sure we'll put the web.
Okay. So let's make sure we stay in touch.
Yeah, thank you, everybody. Thank you, what
Okay.
dude. Wonderful.
Bye-bye.
Bye.